Okay, can everybody hear me? Okay, scoot up a little closer. It won't bite you, I promise. Tom, Dr. Farr, would you come up here? And Lucy, would you come up here? So I'm going to have some assistants. Lucy, come on over here. Come on. For 1955. So before we open these things, first of all, I want to know who has worked here the longest in this crowd. Let's go to 90. Everybody raise your hand if you've been working here since 1990. 80.
We have 40 years right here.
Already there? You just skipping the chase? Anybody here longer than 40 years?
Right over there.
I got two. Okay, how about my 40 years? Come up here and let's get a photograph. Come on.
You should be proud of that.
I am proud of it.
Yeah, I'm getting out your photograph.
All right.
I'm in trouble. Dr. Farrar's been here for 45 years, lady, but I do not want to take that from you all. So in 1956, almost 60 years ago, this hospital was built. So we thought it would be a great opportunity for us to start to unveil what we used to our history, because if you haven't noticed, we have a little bit of construction. There's a little pinch points and little pain points, but I will guarantee you, you will have a hospital that you deserve to practice and to provide great health care, because I know you do it today, but you do it in a facility that is 60 years of age. So thank you for what you do every day for our patients, because it does not go unnoticed. So we are investing $175 million. Remember that number? Not 176 or 174, but 175. This is very exciting. What I will tell you, we have asked Dan Miller, who's in the audience, to write a history book for us. And through his research, he was able to identify these, not tombstones, right? Time capsules. Don't hit me, Lucy. I have fun here. So Terry Northerner was the one that actually told Dan where they were located, because we knew they were here, but nobody could kind of tell us where they were at. So thanks to Terry, if you see him, and it is my understanding that there might be another one, maybe two more, that are in the cancer center. We believe one may be buried in about a 7-foot vault, so we won't see that anytime soon. But without any further ado, I think it's time for us to open up and see what was going on in 1955. Oh, Lucy, I got some tools for you. I tell you, hold that one. Hold that, Tom. Does anybody notice that? Get over there. Hold on one second. Let's get.
Do you mind if we lay it there?
Why don't you loosen that a little bit? Does anybody notice that they look the same? So let's be honest. We do believe this one might have been opened. There's no pressure here.
Yeah, there ain't, isn't it?
Oh, don't move.
She's coming. We stand back up?
Yep, we're back up. You want gloves, Lucy?
There you go, Lucy.
You want some gloves? You want gloves? All right. If you want to, I'm not going to. I
These
feel
are a
like
little bit smaller. Okay.
All right, are you ready?
No.
Just pull it out.
Okay.
Looks like we have some newspaper articles from, hold on, Lucy, let's see. March 25th, 1955. July 1955. June. April. Uh-oh, looks like there's another April. April headline, polio shots begin tomorrow. All right, what else you got, Lucy? Okay, let's see. We've got some magazines. Okay, what is that, Tom? These are pledges of $1,000 and up. So these were our founding fathers who donated money so our hospital could be built. That's pretty neat. Did anybody guess any of this stuff? So we have lots of stuff, and we'll put all this out in just a moment when we get all these open so people can come and feel free to look at this. Lots of photographs. Think big. This is important. Think big, start now. On the back it says V for Victory, William Book of
Indianapolis Chamber of Commerce.
Indianapolis Chamber of Commerce. We'll put all those out. More photographs. What else you got, Lucy? What is this? What is that, doctor?
That would be some Salk polio vaccine. 10 cc's. We don't even use cc's anymore, but that's what it was.
Tom's going to take it. Let us know if it's any good. Looks like we have the bylaws or articles of incorporation. And you know what? Some things never change. This is a thing about women at work, and I'm sure this is our wonderful volunteers for all the stuff that they've done.
That's a book by Eli Lilly, from Eli Lilly, about the medicines that they had at that time. It's about the medicines they had at that time and the diseases they were taking care of that Eli Lilly made back in sometime in can't find it 1950. Okay.
All right, we're not done, Lucy. What else is in there? More photographs.
Try Nixon.
Oh, sorry. Let's try Nixon.
Kenny was a little younger at that year. I remember him.
This was a thing from the groundbreaking ceremony on Thursday at 3:30 p.m., which is interesting. September 23rd. I don't see a date on there. Doesn't say. Okay. For the architects, this was Indianapolis Hospital Development Association. This was their fundraising activity. Their goal was to raise $12 million, and it has all of their campaign chairs and who did what. This is interesting. It's from the American Heart Association, their annual report of 1954, and it's talking about speaking from the heart, which is kind of interesting to me because this institution has always spoken from the heart from day one, and that is really classy. We're going to have a new gig in town. It's the Lily Review. Oops. And I really like the dresses that they were wearing. So. So this is a modern hospital from 1955, and there are things, the headliners here are protecting against theft. Some things don't change. The real reason student nurses fail. Training employees in fire safety. causes of delay in the operating room.
Doesn't happen here.
No. And evaluating nursing performance. Isn't that funny? This is another great one right here. Hospital fund solicitation to start here June 2024. So, you know, we've said it that this is where we started. This is so we are planning on spending our money to be here for the next 50 years. And I saw that. I was waiting. So, would love to know who folded this flag. And for all of you all that are veterans, thank you for what you've done for all of our freedoms. And this is just awesome. Oh. Well, you got had Dr. Farrar, you didn't have Richard Nixon speak as the keynote, so that was even better. So thank you very much for all that you've done.
Hey, it's been a pleasure. I love being here and just want to keep staying in communities. It's a great hospital, great institution.
Thank you.
Thank you, sir.
Okay, John, Paige, Al, and Susan, you get to open up this one. Where's Alan? Oh, there you go. Still. Hey, Judy, come up here. I'm sorry. Hey, Diane, why don't you come up here? Where's your buddy at? So Judy tells me that she started volunteering here. When, Judy?
July of 1991.
Wow.
I was in high school when the hospital opened. Cecina, just not very far away. Very special time.
Linda, you going to help us? I'd like you and Diane and Judy to take out these contacts. So this one hasn't been open, has it? All right, Judy, you pull first. What do we find in 1991? So what dates are they? August. So in August, the headline was Soviet Union under siege. Huh.
Memories of 1991.
Oh, that's pretty cool. So memories of 1991. And lots of sell ads. So if you want to buy something, so.
And coupons.
And lots of coupons. So the world changed from 1955 to 1991 till we needed more coupons. You can't look, you just have to.
We have Sturm Communications Community Hospital checking our pulse.
Stern Communications.
Checking our pulse. So that's something we'll watch later. Keep that a VCR.
Yeah, does anybody have a VHA around?
Operation Recycle Community Hospital.
Okay, Judy, what's next? So Dan, we were looking for lots of stuff for the book, right? I think we've just hit the mother lode. So we've got Mr. Corley in the photograph. Let's see who. Let's see who else is on there. It does not say what year. Who else was in there? So we'll set that there. That's interesting. What was the quality like, Judy, back then? Excellent, I'm sure.
Always patient first.
Yeah. So that was January, it looks like, actually 1992, so. There's copies of the organizational chart. So Mr. Corley must have had a coach. So obviously I need a coach. I hope, hey Pam, I saw you.
Lots and lots of paperwork. Oh, training.
Yeah, here's a training manual about avoiding the pitfalls, carefully explaining the purpose of the study and exactly what you plan to do with the data. We're still trying to figure it. We found the truth finally. We've been looking for it. All right. Linda, what else can you find? You can't cheat. Nine survived. What's it say? Don't tamper with me. Anybody know what that stands for? So who has one of these shirts at home?
Who's wearing it today?
All right, Diane, what can you find?
Oh my gosh, and who read the Deming management book? I read it.
The Deming Management Method. Yes. Words to Live By. And Coping with War, Issues and Answers. Community Hospital, Indianapolis. Yep.
What else, Judy? Are we done?
Oh, no.
You know, can you imagine in 1991 what was going on and what the importance behind this flag at that time period? All right, Linda, what are you going to pull out? All right, just to tell
It's like
them.
a poster.
You're the best part of our attention-getting campaign. We're an exceptional healthcare system because of the people who work here, and our new advertising campaign tells Indianapolis just that. That's a lot to live up to, but it's a lot more to be proud of. Amen.
All right.
All right.
We have more ads from Sears, Penny's. The Strategic Plan for Community Hospital 1991 through 1996. Standard Policies and Procedures. Oh, there's a bill here, I think. This will be good. This will be good. Average prices in 91. Med-surg bed, $321 a day. A chest x-ray, tube view, $64.
Oh, it gets better.
CAT scan without contrast, $327. Respiratory therapy, chest physiotherapy, $16 a treatment. An eggshell mattress, $21. Oh, this is a good one. A 2-day stay for mother and baby, vaginal delivery, no comps, mother and baby healthy, $3,200 to $3,600. That's what it costs to have a baby back then.
I think it costs a lot more than that.
And these are just more magazines. Newsweek. Newsweek. Oh, wait a minute. This is addressed to Community Hospital. Our new service takes the pain out of getting medical attention. Oh, it's from. So it must be something that we sent out to folks back in the 90s. celebrating the continuing success of Community Hospital's 35th anniversary. That's pretty cool. Our guiding principles, I remember these.
Have they changed?
Well, let's check them out. I'm going to go over these right now. Our mission shall be accomplished through adherence to the following guiding principles. We meet and exceed patient, physician, employee, payer, and public expectations through continuous improvement and innovation. We provide an environment of trust and respect which enables physicians and employees to realize their full potential as individuals and members of the healthcare team. We work in partnership with our physicians and employees to provide excellence in facilities, technology, and service to best serve the needs of our patients, physicians, employees, payers, and public. We anticipate and meet the financial requirement necessary to ensure a fiscally viable future. We strive to be a responsible member of the greater Indianapolis community and to work cooperatively with other healthcare organizations to reduce unnecessary duplication of capital expenditures and service. Here's our mission. Our mission is Community Hospital is a not-for-profit integrated healthcare team network which serves as a leader in providing compassionate, quality, cost-effective healthcare services to help the people of greater Indianapolis achieve and maintain optimal health. Our quality policy throughout the Community Health Network, quality is providing healthcare service to meet the needs and expectations of our customers through a commitment to continuous improvement and innovation. And our vision, by 1996, Community Hospital Indianapolis will be a patient-centered, integrated healthcare network which will, through continuous quality improvement, consistently provide a better experience for patients, employees, physicians, payers, and thus become the network of choice. True story.
I think we've met that one.
All true.
All right, Judy, we can close? Oh,
Grab a handful. Oh, Dollar Days.
Kmart.
It is Kmart. Let's see what we got here. Unit information. Unit 8, creating a collaborative culture.
so this looks like it's specific about the unit. So there's Unit 8. Anybody remember Unit 8? Oh. Anybody remember Unit 9? This must be part of the book, maybe the chapters of the book. It's kind of interesting. We were talking about organization transformation back then, learning objectives.
Some things never change.
No.
Okay.
All right, you gonna finish it up, Linda?
Drag it out.
Let's see if you can pull it all out at once. All right. Oh,
This is starting salaries.
oh, now this will be a good one. Hold on, this is gonna be fun.
Environmental service worker, $5.65 an hour. A registered respiratory therapist, $11.51 an hour. A pharmacist registered, $17.65 an hour. Physical therapist, depending on education, $12.39 to $16.33 per hour. A registered nurse, new graduate, 2-year degree, $12.80, and a BSN, $13.12 an hour. It's changed a lot. We're changing what most people look for in a hospital. It says you've got our attention. And this is your chance to change medical history, and you've got our attention and for people to fill out and send us their information. Another poster for fast, effective pain relief 24 hours a day, try 7 of these, and it's the 355-3535 number to get our attention. This is the Armstrong Medical Industries order book. Most catalogs do not have pricing on med-surg items, and that was from 91-92. and Community Spirit, a magazine that we sent out, some photos. The first edition, Historical Documents, Depository 1964. Second edition, Historical Documents, Depository 1974. Future Building Historical Documents, Depository. Then there's one 55, 64, 74, and the future. Pictures of those. And then the 28-acre site on which this hospital was built was given by Edward F. Gallagher in memory of his mother, Pearl Marie Gallagher. And then a little notepad, you've got our attention.
There's more, Judy.
Oh, a flag pin that I dropped back in. And victory. And some pictures of our hospital.
All right, Paige, we're going to let you finish this thing off. Come on up here.
So this was a picture of the headstone for the time capsule that we couldn't find till Dan found it. Oh,
That's when they must have opened it.
and this is when they must have opened it to put it in this. So the opening of the original time capsule. With all the contents photographed. Photos of the building with the new professional office building, new photos.
Yeah, does anybody remember before she goes why this time capsule was done in 1991? What was going on? Professional building, right? The new entryway that we're standing in.
I remember this T-shirt. I won't undo it, but I will tell you what's on it. It's like a big map, and it was after South was added. So there's a picture of like east, north, and south on there. You can kind of see. It's like a picture of Indianapolis. So that's it. Thank you.
Well, what I'd like to do, this is about our team, so I would like to take this mic and make it open for anybody that wants to say anything that's worked here for a number of years. But what I would tell you, what makes community so special is, Pam, you got something to say?
They're all running away.
Is the people that work out here that take great care of the patients every day, and I just want to take a moment to say thank you. We build on a strong foundation, as you can see, from caring for people, and that's what we do every day, and that's what we'll continue to do. And finally, we'll give you a new facility. We're going to go from the oldest facility in the city to the newest facility in the city. And I would just ask for a little bit of patience as we work through a little pinch points with parking and some of those things. And remember, we're making it better for our patients and for you. So thank you all. So the mic is now open.